put a pillow underneath her right here in an acute phase. When we get to a subacute phase and she wants to start rolling around a little bit more, I would try to teach her to sleep on her side with a pillow between her knees, okay? Again, still maintains that neutral posture. What I would not want her to do is sleep on her stomach, which you do all the time, right? She just does. You know, it took me about 6 months to learn how to sleep on my side.
I sleep on my side sometimes.
Yeah. So you just got to figure it out. So let's start with. So we talked about neutral spine, neutral pelvis, if you will. How do we progress that? Okay, how do we make it harder? It's no longer a challenge for her. So, Camille Timms, how can I make that position or this exercise more difficult for her, more challenging?
Like she's in neutral right now.
She's in neutral right now. How can we challenge that neutral posture?
Like add resistance.
Let's look at her arms and legs.
You can put her flat.
So she's already neutral spine. What if we have her bring one knee up? Can you do that and maintain that spine? How you feel? You okay there? How about we march you in place?
Like march?
Yep.
Okay.
Okay. Is your pelvis staying relatively neutral? You're
I
not
think so.
hiking into this hyperlordotic posture or anything like that, okay? All right, so I gave you the first one. What's another one?
So you can move her arms.
You move her arms. Why don't you instruct her how to move her arms?
You can put your arms above your head. You can like.
So inherently, going into a more extended posture is going to bring her into more anterior tilt, would you say? So that right there is a pretty good progression to start, okay?
Could you do your legs with that?
You could do her, oh, now we're cooking. Now we're cooking. So talk me through that.
Okay, so you're gonna keep your arms in the same position, and then you can march your legs like you were doing before, and make sure to keep your core tight.
Does your core stay tight? Does you stay neutral? Good, that's excellent. All right. What if we had right hand to left knee?
I can't march.
Well, you don't have to march.
Oh, okay.
There you go. That's probably easier than the marching part. All right. Maggie Wood, make this harder.
Can she do the like this bug extension?
Absolutely. Walk her through it.
Okay, so you're
For you
gonna
that
take
don't know what the dead bug is.
you're gonna take your right leg and extend it, and your left arm and extend it at the same time, and then bring it back and do the same thing with the left leg and the right arm.
I'm not coordinated enough to do that. Like this?
Stop at a neutral position.
You gotta stop. You gotta
Like
go
connect to what's
over some
going
tactile
on.
cueing. Tell her
Help
what you
me.
wanna do.
So keep your knees up like this, and whenever you extend, I want you to extend out, and then come back to this position every time, so that one of your knees is bent.
So now am I touching?
Yeah, touch, extend, and then do the same thing with this one.
So this one's coming back.
Yes.
I'm so confused.
Can I just demonstrate it for her?
You can.
Okay.
You can.
Yeah, I'm not coordinated.
I want you to be like this,
Okay.
and I want you to extend.
You're not getting a rest, really.
Oh, okay.
Just like that.
So how do we know if she's maintaining that neutral posture?
You keep her core tight.
Exactly. You've got to put your hands there and say, okay, are you staying tight here? Okay. Yes. That's a
Oh,
really
wow.
good
Getting
exercise.
the workout. Jesus Christ.
Cam Sargent, Can you
Oh,
put
Lord.
her in a different position and make it challenging?
Absolutely, lay on your stomach.
Yeah.
Do a Superman's.
She doesn't know what Superman's are.
Yeah, I did.
You gotta bring your arms and your legs up at the same time, you're gonna hold it. Contract that core every time. Do that for 10 times. Hold it for
All right.
5 seconds.
So think about it though. Here's somebody with a little bit of hyperlordosis anyway. We're gonna extenuate that with this. So maybe that's too much too soon for her. So how can we scale that back a little bit? And still maintain this neutral posture that we're trying to. Again, we don't want her to arch more, okay? Can we do something?
With could you kind of like a alternating crunch?
But we already had her in supine. I want her in a different position. What do you think, Miles? You have
Can we
an
do
idea?
bridges?
What's that?
Bridges?
Well, again, that's going to be more in the supine position. And again, bridges is going to make more.
I was thinking plank. That's what I meant to say,
Can she
plank.
do a plank? Oh, please elaborate.
Well, we'll just put you on your elbows. So you're gonna have your elbows out in front of you. Like keep your legs shoulder width apart, but you can kind of tuck them up under you a little bit. Okay, and then you're gonna push up through your elbows and like hold your body flat. So you want your body to be like flat as possible. We don't want you to drop low. You want to pick your stomach up a little bit.
See, it's not fair. Y'all know.
And
what
then
these
engage
things
your
are.
core. So keep your head neutral because you don't want to like keep
You
going.
can explain it to a patient. You know, idea.
But engage your core and hold your body up. So brace yourself. All of this is gonna come from your core.
It's spinning my arms. Because I'm shaking over here.
So you can go for your and then you're up on your toes. Don't let your hips drop. Keep them neutral.
There you go. That's good tactile cueing right there.
You go down.
Yeah, I'm going down. No.
All right.
Very long.
All right, Brittany.
Oh,
Come
no.
I'll do it like this.
He's like skipping 4 steps here.
Lauren.
Hold it just like that.
No, thank you.
Oh, it's awful.
You can just progress to a push-up point.
Yeah.
Cam, stay there for a second. You look good at the model.
Yeah, there you go, Cam. Your turn.
Brittany's tired anyway.
Yes.
Okay, so maintain a neutral posture right there. It's certainly a arm and core workout.
You gotta tuck
Now.
your chin back in.
Yep.
Get it out.
How about take that and do that clock exercise with that? Oh my goodness, that is brutal.
Oh, gosh.
Now, how could you make that harder?
One leg.
Huh? Do it on one leg. See, look at his pelvis immediately. It dropped, didn't it? Okay, it's very hard to maintain. All right, so now we handle the prone. Let's go to sitting. Danielle White, start us off on the easiest neutral pelvic positioning exercise in a seated position. Brittany, you can be the model again.
You're gonna see it.
Yeah.
Anyways,
So just trying to, so you're gonna want to bring, so you're slumped like this. Try to roll your shoulders back. And be straight and tall. There you go. So this would probably help.
that's pretty good. All right, so how do we progress that, Sam Kiefer?
We're still working on
Neutral pelvis in this position. Can't use the clock because we already did that. Carson, help him out.
So is she in neutral pelvis currently, or are we trying?
I don't know, is she?
Okay, so tuck your butt underneath you. Don't like poke your butt out. You know what I'm saying? So tighten, yes, like that.
Okay, so you, good correction.
Okay.
Now, how can we make that challenging?
I'm thinking.
You can change her position, you can change her movement, you can change the environment.
You could put her in a chair with a back.
Chair with a, actually, that's gonna be harder than a chair with a back,
Okay.
because she's got no support. Don't overthink it. How about just having her march in place?
Okay, will you march in place for me, keeping your pelvis neutral and your shoulders back?
Okay, now how would you make that harder?
Now you could do. She could hold.
She
one
could
leg
hold,
up.
yep. She could hold, she could extend the leg.
Now extend. Okay, I'll try on the other side.
You can incorporate the arms opposite the leg.
Like a crazy bug.
There you go, crazy bug. Okay. How can we change the environment altogether? Hint, hint. You put them on that ball and have her do these things, things get really interesting really quickly, okay? This is what we've got to think about, is how to make something easier and how to make it harder, okay? Because you're gonna get presented with a patient and they're not gonna be Brittany. They're gonna be older, they're gonna be stiffer, weaker, in pain, right? All you guys in here are none of those things. Some are older. But you gotta be able to fit this square piece into this round hole. So we either gotta change the size of the hole, we gotta change the patient. It's hard to change the patient. You gotta change everything else. All right, is that making sense? So let's start talking about extension bias, and I alluded to this the other day. Logan Karcher is our patient, and he's gonna need that whole map. Kristen Matus is our PTA. Logan needs McKinsey exercises with an extension bias. He is in an acute situation. He is miserable, okay? So we're gonna start with simply putting him in present, okay?
Yeah, he knows what
I was gonna say.
No, he's awful bright, this guy. All right, so from right there, take the progression.
So if you could just come up on your elbows.
Okay? Now let's say he struggles with that a little bit. Would applying, what we say, PA glides, posterior to anterior glides of the spine, could that be helpful in this situation?
Like
Help
would
him
make it
achieve,
feel better, or
help
just-
him achieve more extension and feel better, yes. I think both of those could be.
Yeah.
All right, so we can have him in this position and do glides.
Mhm.
Okay, so you could put a pillow underneath of him, that might be okay.
Okay.
So there's using some hands-on technique to supplement what you're doing. All right, so what's the next progression in this?
Like pushing up on your arms.
Okay, talk him through that.
Okay. If you could put your palms flat on the table and just kind of push up like you're doing a push up.
You're hurting.
I am.
Are you? Yeah. Okay. So his pelvis isn't down on the mat.
Mm-hmm.
So how can we change that? He can't get there right now. How do you adjust it? How do you make it easier for him?
I mean, you wouldn't want him to go up as far as his arms.
Right. So walk his hands forward a little bit.
Walk your hands out some.
Even more. There we go.
Okay.
Now he's in the position. Okay.
It's hurting.
Does not feel good.
Still no good? Go back to elbows. All right, so he might not be ready for that. But that's the progression that we want to get to.
Okay.
To the front press up. Now, Caitlin McGrayer, how would you teach him to do this in standing?
Okay, you stand up for me.
And keep your legs straight and your hips. Don't move your hips. Just try to move your upper body and lean back as far as you can. I guess.
Can you do something with his hands? Give himself a little more support?
He could hold on to something.
He could. He could either hold on to something and let his hips go forward, or he can stand like this maybe and give himself some support. That's a little better. Okay. Good. Now, Taylor Brown. He's been doing this. He doesn't have any pain anymore. We got to get him stronger.
Where's Taylor Brown?
There's Taylor Brown. How do we get him stronger? Well, show me how you're gonna do that.
Don't let him.
We may have already gone over it.
You could have him in prone and have him extend and then have resistance.
Let him.
Love it.
So you're gonna get on your hands again. Figure on your hands. No, like lay back down. But you're only on your elbows.
Elbows.
Okay. And you're gonna be. He's gonna extend and I'm gonna. I don't know.
Okay. Have him lift the leg.
Lift your leg.
Put your hand on his back. You feel his back muscles contract.
Yes.
Okay.
So I will push down on his legs.
You could put an ankle weight there. You can do a lot of different things. Okay. So he's almost fully in contact with his trunk, right? What about if we put him in what we call quadruped? You know what that position looks like? Hand on all fours.
Hands and knees.
Okay. Now put your hand on his back and have him extend the leg.
Extend your.
Now, do you want his back to arc to dip down like that?
No.
How are you going to teach him to not do that?
Extend your leg. You're gonna wanna tighten your core.
There
like
you
this.
go. That's it.
Try to keep the back straight, okay? Do it again.
This is one other thing too. He's really lifting his leg really high. It's almost impossible not to go into that anterior tilt. So I would put my hand under his stomach and put the other one on his back and say, that's your neutral position.
Okay.
Now just straighten your leg. Don't lift it, just straighten it.
Just straight.
That's better.
I can feel him come up on this side.
Okay?
So
So
I'm
give
kind
him-
of pushing down.
Give him some cueing, yeah.
Okay.
Like I'm doing
He's
yoga.
not very good at it. All right, so we can have him alternate legs.
Mm-hmm. You're still slouching on this side.
Get
Tighten
on
your
his
core.
hand. Straighten up.
You're still slouching. Do it again.
It's not gonna be comfortable.
Not this leg.
I promise you I'll make it.
All right, so how do you make it more difficult? He's got that down now. Those hands are good for
Make his
something.
arms come.
There you go.
One arm. Just put one arm up. Do it
Just one arm?
Just one arm.
That's a lot easier than lifting a leg. His arm weighs about a third of his leg.
And then lift this arm up. And then lift this leg up.
There you go. Good. We can do the other side.
Okay. Other side. You're still turning.
Tighten your core.
How do you make it harder yet?
Hold it.
Hold it, okay? Hold it. What did we talk about PNF? Perturbations, manual resistance. Tip him over. Get him up in that position and give him a little nudge. Roll him. Push him.
Okay, dude.
Maybe not that hard. But you can just do, look, you can do really simple things. All right, get in one position. All right, I might go here, 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 here. He's having to contract everywhere to maintain that posture. That's what we're trying to get out of this. Okay? Well done, Mr. Carter. Well done.
How's that core feeling?
Extension bias is for the folks who have maybe some discogenic pain, or we bent forward too far this way, our disc is pushing out this way. Okay? Flexion bias would be the people that we're trying to open up the joints because they've got more degeneration and so forth. Yes, yes, yes. All right. Let's talk about flexion bias. Our patient is Levi Spates. You've already been a patient. You don't have to be a patient. Miles Johnson is our patient. Miles is a 78-year-old man with lumbar stenosis. He's a mess. He just hurts. His legs just don't work very well. He's got chronic low back pain, kind of goes across. His MRI and x-rays look terrible. Rebecca Lager, how are we going to start working with him to open up those facets and get him a little more room to breathe back there? Big flexion bias. This is somebody who's poor old man.
No, he can't. He's too. Can I have you lay down on your back, please? Okay. So I want you
Well,
to just bring
it's more about
these legs
their
up.
pain level. I don't allow for that. They can't get into
Alright,
extension.
and I want you to try to bring your knees as close to your chest as you can.
Hold.
And hold. How does that feel?
That feels better.
That's good.
Hold, and then you can release. We can do one leg at a time.
Can you walk him through that?
Yeah. So I want you to relax. So now I want you to bring one leg up at a time. So first this one, and hold.
How long do you have him holding?
Okay.
So like 5 to 10 seconds. I want to do 10 to 15 actually.
Okay.
And then we'll switch.
That's definitely going to open somebody up that has compression in the low back. Okay, that's a good thing. All right, next, Mrs. Johnson. Take care of your husband here.
I don't know if there's a
All right.
Ma'am, I'm in pain. I'm 78 years old. Don't talk to me like you know me.
Help me out. Don't give me the answers. Ask me a question because I don't know
Okay.
where to start.
All right, so we've got somebody who's got degenerative spine. So their spine is getting crunched this way. How can we lengthen their spine? Think of big back muscles. Name some big back muscles for me.
Lats.
Lat. How would you stretch his lat? He doesn't have to stay in this position.
Well, can I have him do like a crunch like that?
You could, but he's not ready for that. We're just trying to lengthen him right now. That would be a good idea, certainly. How will we stretch his lat?
Can I just say that? You can even sit if you want to.
hurts to straighten. He likes that from hunched over a little bit.
Okay, well go
He can handle that though. Let's say he
Okay,
can
so
handle
just
that.
go as straight as you can, okay? And then come over, and then kind of just like twist your body towards me. Try to keep your back as straight as you can.
What if we had him hold on to something?
Like a palm.
Yeah.
Like maybe the tremolo.
That might work.
Oh, okay.
Get on it, old man.
So remember when we're walking, we want to keep it as straight as you can.
Ma'am, I don't have one of those.
Okay, so do that same thing.
Can we go this way? Where's his lat? Yep. Is that stretching?
Turn towards me.
There you go.
Great.
Again, think about making his back longer. That's what I always preach to patients in this condition is think about making your back as long as you can make it. So he's getting stretch here, but it's really not impacting his low back very much.
Let's go back here. So I think the easiest way to show you is literally show you. So put your hands here. Okay, so then take maybe 2-3 steps out. And then kind of lean your body weight into it.
That's shortening it. You're trying to do this right side. Is that right? Probably not. I'll tell you my favorite place to do this is at the kitchen sink over here. Right here, things going to the opposite side. Your hips and your back. Go the opposite way. Try this. Oh, that sounds good. Go away. Back up. 3 feet. You getting in here? Okay. So we know that comes all the way from here. You can see it on him. Comes to right here into the fascia here. Okay, so we're getting a good stretch here. That's one thing we do. Let's say he's a little more mobile and we want to try something like that in quadruped position. Britton, can you help him with that?
In a quadruped position. That's
Quadruped position to stretch his erectors and his latissimus. Again, a 78-year-old might not be able to do this, but let's say it's a 55-year-old. I can do this.
So then we could do the child's pose.
Mm-hmm.
So that would be quadruped. We could start off by just straightening our arms out and then leaning back and then progress to where we get to right here. So if you could go on all fours and then start to stretch your arms out and then push your hips back. Push your hips back a little bit. And as this progresses, you can keep going into the child's pose.
If you want to stretch specific lat, let's say his left lat is tighter than the other.
Then you could do that same thing, but bring it to the opposite side.
Exactly.
So,
Everybody try that right now. Get in that position and try that stretch. Just work your hands around. We're going to talk about lengthening your back. This is how you do it.
Feels good for you?
And again, if you can't get somebody in this to this position, you can get them at a countertop. You can get them at a sink. agree that hamstrings could be influencing pelvic position and then back, okay? Thank you, folks. Our new subject is Kayla McCrory. Good. How can we stretch her hamstrings in the safest manner to not impact her low back any more than we need to? Faith Barker, can you help her with that? The easiest way to stretch your hamstrings without negatively impacting her low back.
I mean, couldn't she? Well, when we do it in the, we can get like a stool, we put their leg on.
Okay, but again, that's a lot of pressure on someone's low back. So I'm gonna give you a hint. Stretch them in supine to begin with.
Somebody, you just do it like you just passively do it yourself.
You can do it passively, but I want you to teach her how to do it herself. I know you know how to do it passively, so teach her how to stretch her hamstrings in supine position.
So basically, what you're gonna do, I'm gonna show you how to do it first. So what you're gonna bring your leg up one way.
I'm not gonna be able to grab my leg, babe. For real.
We got a good subject for this one.
But someone that's not able to hold their leg, though, you would get something so that they could assist.
We got all kinds of props over here. Spectacular.
I didn't want to make it harder on you, but I can't.
Good. You go be doing this yourself. So we're gonna put this, and you're just going to pull your leg up to as far as you can for yourself. Then you hold it for a little bit, then let it down. And then
All
once
right,
you
so
press
that does minimize what's going on in her back. Now, could she have some nerve root issues? And as soon as she pulls her leg up, she gets this shooting pain? Absolutely can happen. Then we just can't afford to stretch her hamstrings if that's the case. Okay? That's good. That's a great way to do that. Someone says, oh, I like that, but I don't have one of these straps at home.
I mean, they could get, well, they're able to lay on the floor. They could do it on your wall.
We'll talk about that in a second. What could they use instead of that strap?
They have like a belt.
A belt, a dog leash, a sheet. Any of those things can work for the hamstring. Yep, all those will work. Okay, that was excellent, good. Now, Jasmine Cunningham, how are we gonna make this a little bit harder and a little more challenging?
The straight leg raises.
You could. Show us what you got.
Okay, so we'll keep this knee bent. We'll start with the sleeve. So keep this one straight and bent. So you're gonna try to make sure your lower back is still touching the table, and then you're just gonna raise your leg to about probably my hand. Hold it and then drop it down. Okay.
So that's a strengthening exercise for what?
Hamstrings.
No.
Quads.
Quads and hip flexors. Okay? So again, show me how we can stretch your hamstrings a little more effectively.
Stretching hamstrings?
Stretching hamstrings, not strengthening.
In this position.
Doesn't have to be. Matter of fact, I think we've exhausted what we can do in this position.
Okay, you can sit up and then. You can slide back. Are we still like taking her back out of the equation, or?
Trying to minimize it.
That won't work. Stretching hamstrings. So she can't bend over.
We don't want her to bend over like that now.
She wouldn't be able to do the I mean, I could use the rope in this position as well.
You could, but we've already used that prop. So.
Right. That's strengthening.
How about
Something in.
How about one leg at a time in this position?
But that would strengthen hip flexors. Oh, like stretching. But she wouldn't be able to bend over.
Bring one leg off the table and one leg on the table. On the side.
To the side. Oh, okay. Yeah. One leg off, one leg on. And then.
What kind of prompts or tactile cue can you give her to minimize what's going on in her back? I'm not saying eliminate, but minimize.
Okay, so if you're trying to reach for your toes, we're gonna stretch your hamstrings. But you wanna keep your neck straight. You don't wanna like slump over
That's it.
and reach for it. So like sit up tall first and then reach out for your toes.
I don't think they even need to reach. If she keeps, look, if she
It's
tilts,
stretching right
if
now.
she tilts her
Just
pelvis,
sit straight
she's
up.
she's gonna get a stretch if she just leans her nose forward. Keep your back straighter.
Yeah.
How do you go get her to do that? There you go. Put your hand back there.
And then relax a little bit. So like.
Hey, is her head and neck part of her spine?
Yeah, so her head should be neutral.
So if her head goes down, that's probably not gonna be a good thing. Keep her head up.
Keep your head up.
Could you just tell them to look up while they're
Yeah, yeah.
and do fix them?
That's a great stretch right there, is it not? Yeah.
Does not feel good.
And what if we get her to pump her ankle at the same time? Is that gonna add a little bit to it?
Yeah. So like as you reach, once you go up, pull your foot back. So point this foot back.
Yeah, I can't lean up.
Just stay in this position.
It's not happening.
So sit up and pull your foot back at the same time. To get that straight.
That's probably all she's got.
Wonderful.
And that's okay. This is real life right here.
I never like.
But her back is relatively straight. So there's I won't say there's no pressure, but there's less pressure on it than if we have her do this. Okay? All right. We'll get to that later. Well, that's pretty much that. I just want you guys to be able to think about the anatomy and be able to apply it. Okay? Let's get to your case.